Hi everyone, how are you? It's been a long day. I've been watching it from the sidelines, and thanks so much for the invitation. And congratulations to Raj and the entire team for bringing out this wonderful opportunity for people online to think about medicine as a career and other healthcare professionals to come together. So obviously I often talk about the future. This is one version of the future. And I was giving a little wave to all the audience who's still here at 6 o'clock. And of course, there's the virtual disco after this, so please stay for that. So I've got a number of roles. I'm a surgeon by background. I do a lot of work on innovation, not just here, but around the globe. And I look at different ideas about how we can accelerate change in the healthcare system. So that's kind of the remit. And I'm going to have some fun in the next 10 minutes or so to showcase a few examples of ideas and thoughts that you may encounter in your future careers. And it's really an exciting time, of course, for you guys, because medicine is changing rapidly, as we've seen over the last 8 hours so on this conference. I'm just going to share my screen and then we can start the presentation. Hopefully it works seamlessly as it has so far in the conversation. That's just that. I'm going to play that. Okay, you can see that's my screen. So look, you can follow me on Twitter, on Instagram, and my thoughts around the future of medicine. The first thing to talk about is that future. What does it look like in the next 10, 20, 30 years? It's a really exciting time to be alive in medicine. It really is. We've never had the riches of technology that have come to the forefront of how we practice clinical medicine, as well as how we educate our medical students and other healthcare professionals. This is the future that you may see over the next decade. So my cry to you as you go forward is that you are the game changers. You're going to be recreating the future of healthcare. And William Gibson talks about the future of healthcare and the future of technology, I guess. And he's a Canadian writer who actually coined the term cyberspace. And the way he describes the future is that basically it's already here. The future is already here. It's just unevenly distributed. And that's quite true. We've seen lots of pockets of amazing work going on around the world. You've seen during the pandemic, of course. So how do we coalesce that to make healthcare more, I guess, more accessible? Of course, this is the world that you're going to be living in, the world of a number of technologies. And technology is the enabler to create a better society. We've seen what's called the convergence. All these things now coming together. We're talking about genomics and robotics and virtual reality, etc. Many, many technologies that are really exciting. And hopefully the next 5 or 10 years, as you progress through your careers, you'll help us shape those conversations with these technologies. The last 4 months, of course, have been pretty scary for a lot of people. We've seen a lot of disruption to our lives, ordinary lives, being locked down, etc. But actually what we are seeing, the advantage of the pandemic, if you can call it an advantage, is that we've seen a compression of time. This is the picture of Final Fantasy IV. And what we've seen in the last 3 months is a compression of 2 to 5 years of innovation in the space of about 3 months. It's squeezed, we've suddenly accelerated, we've springboarded, and we've catapulted ourselves into the future so rapidly. And the question for us is, are we ready for it? Are we ready for change? Are we going to go back to yesterday, or are we going to have what's called the new normal, the reset of society and civilization? And I feel we're going to be able to springboard to the future. If we go back a second, 1924, the way that we interact with our patients at the moment is very much face-to-face. It has been for a long time, apart from the last 3 months. Back in 1924, the futurists talk about connecting with the radio doctor, being connected remotely, live through what they call radio waves, what we now call telemedicine. So they were actually predicting the future some almost 100 years ago almost, and thinking about the future has to change. And now, of course, we've seen an explosion of non-face-to-face contact, virtual consults they're called, e-consults, using telephone triage, or even telemedicine. Many companies out there now offering the service, which makes sense. It's more accessible, it's more patient-centric, and it's kind of probably more affordable in terms of expense. We've seen, for example, in the US, the virtual visits have gone from 0 to 5,000% in the last 3 months or so. It's a huge requirement for this kind of technology. Let's take an example around the world. Give you an example of what's going on. China. If you go to China, I've been there a couple of times, of course, you'll see that their telemedicine platform is on steroids. They have, on Ping An, which is an insurance company, have 300 million users. Can you imagine that? We only have 60 million people in the UK as entire population. And they carry out 160,000 consultations per day. Can you imagine? It's kind of where we're heading towards. It's a lot to learn from other countries. What about this for virtual healthcare? Here, you can actually just go and see a doctor via telemedicine into one of these telephone boxes, I think they look like. You pop in, you see a doctor, you have all the apparatus equipment to measure your blood pressure, your pulse, your temperature, and ECG, which relays in real time to the doctor who's on the TV screen. He or she can then prescribe medicines, and you literally pop out next door, and the medicine's all ready for you digitally into a little envelope. You can take it away and carry on. So this is the kind of one-stop shop, care in the community, being more virtual, being promoted on a global level. Let's go back to reality. Here am I at the hospital, my own hospital. Over the last few months, we've created virtual clinics, and that's me on the left-hand side with my laptop connected to the health record of the patient, and also an iPad connected to a video interface, a clinic. People can come in, wait in my clinic, I can see them. The old-fashioned way of working in a busy outpatients has actually disappeared and will disappear. There'll be less and less of that face-to-face. And also, when you go on ward rounds, remember the COVID pandemic, we're very careful about the contact with our patients. Can I do better? I'm using the beam system. This is me, using my beam system. So that was controlled by my laptop, mobile phone. I could be anywhere in the world, running, going around the hospital. I've done ward rounds and teaching sessions remotely using this method over the last 5 years. And we've had some, I guess now it's much more acceptable to be remote and to be working virtual, which I've been pushing for a number of years now. And I think the society now has embraced that change. A little bit about work around what's called extended reality. Some of you may have heard the terms augmented reality, virtual reality, mixed reality. They're kind of a continuum. And the entire terminology is called extended reality. And also there's a new word that they call, which is called spatial computing, using wearable headsets to immerse yourself in different environments. So there's the kind of terminology that I've been using for a while. If we go back in 2014, I realized we had to train people remotely. We used the Google Glass, which just came out at the time to live stream an operation around the world. On that day, when we streamed it, people interacting on their smartphone, being remote, I taught 14,000 medical students on a single day remotely on an operation. So just showing the power of connectivity and the use of wearable smart technology. We created a whole platform around learning. This is our medical school and virtual medics. We've created learning. This is an operation being carried out where both the surgeon assistant on 2 camera feeds were wearing Google Glass, and the students on the right-hand side were having peer-to-peer learning using chatbot. Way ahead of its time, and now it's more relevant because now we're looking at new ways of teaching the next generation of surgeons, of course. This is virtual reality. So that's virtual reality. So in 2016, I live streamed an operation in VR, so people around the world could use a little Google Cardboard headset and as their smartphone to access an operation. On that day, we taught 55,000 people in 140 countries, just showing that we could actually reach more people using these circumstances. I've also shared operations on Snapchat, on Twitter, on Facebook, and all the social media platforms to reach big audiences. Of course, going forward with virtual reality, one of my companies called Medical Realities, and we created a platform of learning for a new generation of medical students and healthcare workers to be fully immersed in the virtual reality world. You can actually navigate and actually learn any discipline. It could be clinical skills, it could be communication skills, or in this case, it could be surgery. So we record operations, people navigate through the VR content, and you can download this anytime on Oculus or on iOS or Android and play around with it. You're more than welcome to try and get some feedback, and we'll have more and more content forward on our platform. So feel free to play around with this new world of virtual reality, which I think will revolutionize the way we train people. You can go to operating theatre, you can interact with the environment, pick out videos, see how operations are being performed, and actually immerse yourself in 360 degrees to get an experience that makes more sense in the set of current training modules. Of course, we can also create simulation techniques. We can actually operate, learn how to do some skills. Whether it's a surgical procedure or something else, we have to teach you that. We can show you anatomy slides, all that kind of thing, which is going to be fascinating. We also launched our Oscar series for our medical students. So for those students who can't be taught remotely, we can now do remote Oscar training, get your skills up and running. These are available on our app and our platform. So feel free to download, try it out, and tell us what you think as we pour content into the environment. Of course, it's all about globalization. My team went to Sierra Leone, and it's amazing what you can do with this low-cost technology to enable teaching and training elsewhere. So that was in Sierra Leone, a low-income country who can really think about how we promote training. And they have one surgeon per 100,000 people, which is not nearly enough. So we can disseminate this kind of training going forward. The other one, of course, is avatars, holograms, a new world of way of working. And this is me a couple of years ago working with surgeons in India and in America, in New York, at the same time, using the HoloLens system to create avatars. But of course, then we can move on to holograms. This is real life holograms. That's a real hologram. What about if we create holograms in real time, do what's called holoportation or teleportation? We're kind of getting it the next few years. And this is what we did during the pandemic. So we created our own kind of real life hologram avatar, added voice technology so they can recognize your face a little bit, and actually create this. So can you imagine this with interaction? So this is the kind of thing we can do. You're going to be interacting globally. You can reach anybody. You can be as avatars. You can holoport yourself. You can connect with people. And you can learn clinical skills and get trained by anybody. But what about if we really change ourselves to become more digital? And we have this whole concept called digital humans. Could they ever replace a doctor? Could they ever augment our practices? So they're more realistic than you possibly can imagine. So can you imagine that, being a doctor or your teacher in the future, where it has AI and deep machine learning at its heart, and voice recognition, and actually interact with you in a way that may be even empathetic in that sense. So that was really my talk, in a sense, my conversation. Hopefully you enjoyed that. And hopefully now you can join Raj and the team on the virtual disco. And I'll hand over to the team now.